thought about donating a kidney, and what would you do if you had to donate a kidney to a loved one or even a stranger? This is the hard decision faced by hundreds of thousands of people worldwide every year. Kidneys for organ transplantation are sorely needed due to the rising incidence of chronic kidney disease that actually affects 10% of the world population, and 1 in 3 Aussies are actually at risk of developing chronic kidney disease. These large numbers of patients and people at risk is due to the epidemic of obesity and diabetes. So the main difference between a healthy kidney and a diseased kidney is the gradual loss of cells, so widespread cell death leading to kidney scarring and then a loss of function. Now, if detected early and diagnosed early, you can prevent or at least halt the development of disease. But most patients go unnoticed and actually progress to chronic kidney disease and eventually end-stage renal failure. So today I'd like to talk to you about how we are actually changing the future with stem cells and tissue engineering as a new therapy for patients with diabetes. So what is tissue engineering? It's just that, it's the coupling of an artificial bioengineered material together with biological systems such as stem cells in order to try to improve organ health and prevent disease. Now, one such material is called a hydrogel, and this is actually a 3D complex of proteins that are very water soluble. Now, you may not know it, but you're actually surrounded by hydrogels. Did you know that it's the water solubility of a hydrogel within a nappy? Hydrogels also make up contact lenses, hair gels, and even breast implants. It's actually the biocompatibility of the hydrogel in the breast implant that enables it to not reject over the very long term. But we're using hydrogels in a different way. We're using hydrogels as a 3D complex that actually encapsulates stem cells and will provide a new delivery system that can be directly targeted to organs. So stem cells, you've probably heard about, have huge potential for the factors that they produce, these are anti-inflammatory, to the way they interact with cells and even damage cells, and their ability to form all different tissue types in the organ. But there's a huge bottleneck in clinical translation of stem cells in the low rate of cell survival following transplantation. So in a diabetic patient that is a very inflamed environment, these stem cells actually die very quickly. So we're actually using the 3D scaffold of the hydrogel to encapsulate the stem cell to enable long-term survival. If you see in the bottom of the diagram there, you can probably just see the red area is the hydrogel that we can now transplant into the kidney, can survive long-term, and then be a cargo for stem cells and other drug delivery systems in order to try to prevent kidney disease, reverse scarring, and improve organ function. Thank you.